So in terms of preventing arthritis progression, there's really very little we can do from an actual joint perspective to stop the progression of the disease. What we tend to focus more on is prevention of the symptoms. So in the hand, there's very specific therapies that we can engage in to strengthen the muscles and tendons around the arthritic joints that have been shown to be very helpful. We can also initiate a bracing program to stabilize the joints. And lastly, if that fails to work, we begin a series of injections into the joint to try to help calm the overall amount of inflammation down. Unfortunately, those things have a limitation, and oftentimes what we find is that after several years of non-operative treatment, patients remain symptomatic, and at that point in time we tend to begin a more aggressive and surgical intervention protocol that involves either joint replacement or modifying the joints to increase the overall level of functionality. So we initially begin seeing patients and just observing them working on the hand therapy protocols, and then we'd like to keep a close relationship with the patients moving forward, because at some point, if those non-operative interventions fail, we begin to have a discussion about surgery. And at that point in time, a hand surgeon is really where you want to be in terms of planning for the next several series of steps in terms of getting your hand back to where you want it to be from a functional perspective.